The opioid epidemic across America is only getting worse, according to new numbers from the Centers for Disease Control. The Midwest region saw a 70% increase in opioid overdoses from July 2016 through September of 2017. Those numbers do not include Michigan because data from our state wasn't available. But the CDC says the regional and national trends show local health departments should be doing more, including providing more drugs that can reverse overdoses to first responders, family, and friends. Now, Wayne County is already implementing a program that does just that. This afternoon, volunteers are being trained on how to save someone from an opioid overdose. Our Paula Tutman told you about the need for volunteers, so today she takes us to the training and tells us the response has been overwhelming.
136 people from every walk of life in Wayne County learning how to be good Samaritans, how to save the life of someone who is OD'd on opioids.
Once the medication is exposed to the membranes of the nose, it seeps into the bloodstream, and once it's in the bloodstream, it can begin its work.
The workshop by the Detroit-Wayne Mental Health Authority gives free training and free Narcan kits to anyone who works or lives in Wayne County. Robin wants to learn for her church.
People come in and, we just never know what their situation is.
Patrick, a recovering addict himself, wants to pay it forward.
I'm living, breathing proof that because of saving an addict's life, we can give back to help another addict.
Did you get everything?
She's the very definition of poise and intelligence.
I have 4 degrees. So I have a degree in computer applications technology and associates. I have a bachelor's in business. I have a master's in business administration. I have a master's in social work. I'm a certified alcohol and drug counselor.
But Anisha Freeman is what she calls a subculture refugee, a former crack addict, and she lived a crack addict's life.
Living in crack houses, and they taught me how to work the street.
She hasn't had a drink or a drug in 17 years. Everything she's accomplished has been done post-addiction and after numerous attempts on her own life. For 20 years, even she believed she was garbage. But one day, something clicked. And in 17 years, her decision to save herself has turned into saving hundreds of others.
I created a program, and it had such an impact, they had me start working with drug court and sobriety court.
Just as she is poised and intelligent and well-educated, she is the very reason addicts are worth saving.
And there was agencies that helped me stay alive. Even though I couldn't stop, they came out to the streets, and they helped us stay alive until we were ready to surrender. And so there's people who are on heroin and other opioids, and they can't stop. They want to stop.
After more than an hour of instruction in the Narcan workshop, the participants from every walk of life get a certificate and a kit and are seeded into the community to save lives.
You could have a scientist out there. There's people out there. I met people in the dope house who could sing opera. There's so many gifts and talents, and they just have a disease. It's just like diabetes. They can't control that. And so we have an obligation to help people who have the disease of addiction stay alive until they can get to the point where they surrender to the process of recovery.
Wow, she's absolutely compelling. And people get it, Karen, because they wanted to stop the workshop at 100 for registrations. They ended up stopping at 136. There will be more workshops because they want anybody willing to volunteer, willing to carry this kit, who lives or works in Wayne County and can be trained. They want them to carry this kit. Incidentally, it is free. And when I say free to the participants, no tax dollars, all grant money. And they want people carrying these kits to save lives, Karen.
Wow, Anisha's story is so remarkable. We appreciate you sharing that with us. Thank you, Paula.